Invariably, you'll be tested on differentiating the different hereditary disorders with abnormal white cell morphology. These include the Pelger-Hewitt anomaly, Alder-Ridley anomaly, Chediak-Higashi syndrome, and the May-Hagelin anomaly. The Pelger-Hewitt anomaly is a benign congenital anomaly with autosomal dominant inheritance and is characterized by the presence of bilobed neutrophils in the blood smear. A few non-segmented or unilobate neutrophils may also be seen. In Pelger-Hewitt anomaly, the bilobed and non-segmented neutrophils together constitute 50 to 100% of the mature granulocytes, with typically 80% or more seen. A few neutrophils showing 3-lobed nuclei may be seen. However, a nucleus containing 4 or more lobes essentially rules out the diagnosis of Pelger-Hewitt anomaly. The cytoplasm is typically unremarkable, and a thin filament connecting the two nuclear lobes is often seen, giving them the so-called spectacle appearance. True left shift of neutrophils with or without toxic changes may be seen due to another condition unrelated to Pelger-Hewitt anomaly. Of note, there are such things as pseudo-Pelger-Hewitt cells. When this pseudo-Pelger-Hewitt anomaly is seen, the pseudo-Pelger-Hewitt cells generally constitute a small fraction of the total neutrophils. The presence of neutrophils with 3 or more lobes is not uncommon and rules out a true Pelger-Hewitt anomaly. Clinical conditions associated with pseudo-Pelger-Hewitt cells include myelodysplastic syndromes, chronic myeloproliferative disorders, acute myeloid leukemia, HIV infection, chemotherapy, and other drugs including sulfonamides and colchicine. The Alder-Ridley anomaly is a rare autosomal recessive disorder and is characterized by prominent azurophilic granulation. The granulation is similar to toxic granulation and is seen in essentially all white cells and macrophages of the blood and bone marrow. These granules, also called Alder-Ridley inclusions, stain dark purple with a right or right Giemsa stain. Similar morphologic abnormalities are also seen in various types of mucopolysaccharidoses, and the Alder-Ridley inclusions consist of acid mucopolysaccharides and stain metachromatically with toluidine blue. Next, Chediak-Higashi syndrome is a rare autosomal recessive disorder and is characterized by the abnormality of large gray-green inclusions of lysosomal origin in the cytoplasm of essentially all granule-containing cells in the body, most notably seen in the white cells, including granular lymphocytes and monocytes. These granules stain positive for myeloperoxidase and acid phosphatase. The cells containing these giant granules are functionally impaired, and clinically an accelerated lymphoma-like phase characterized by pancytopenia and diffuse lymphoid and histiocytic proliferation of the bone marrow, spleen, and liver complicates the disease in well over 80% of cases. Rarely, you may see blood smears from patients with pseudo-Chediak-Higashi granules, which are typically seen in few white cells in the peripheral blood smears. Pseudo-Chediak-Higashi granules can be seen in patients with acute leukemias, chronic myeloproliferative disorders, and those receiving chemotherapy. And lastly, May-Hagelin anomaly is a rare autosomal dominant condition which is characterized by large basophilic cytoplasmic inclusions that resemble Dolly bodies in the neutrophil lineage. Sometimes these inclusions may be seen in eosinophils, basophils, and monocytes. Typically, there is a thrombocytopenia with giant or large platelets, which are typically poorly granulated. May-Hagelin anomaly is caused by a mutation in the MYH9 gene, which encodes a cytoskeletal contractile protein for the non-muscle myosin heavy chain 2A. This protein plays a functional role in cell motility, cytokinesis, phagocytosis, and maintenance of cell shape. Other MYH9 related disorders include Epstein syndrome, Fechner syndrome, and Sebastian syndrome.